We all have memories of the past, of an era filled with a different kind of hope. But for some, that time was marked by a quiet terror, a time when a mysterious illness began to take hold, claiming lives with a speed and ferocity that left doctors baffled and communities in shock.
Will be right there to assess.
This is not just a medical story. It's a human story of fear, neglect, and overwhelming loss. But it's also a story of extraordinary courage, scientific brilliance, and the relentless fight for a second chance. This is the story of HIV/AIDS. In the dim light of the late 1970s, the earliest hints of a devastating epidemic began to surface. Yet it wasn't until 1981 that the world truly became aware of a looming crisis. In the bustling cities of Los Angeles and New York, doctors encountered a perplexing and frightening phenomenon. Young, robust men were suddenly falling ill with unusual and aggressive forms of pneumonia and cancer, diseases virtually unseen in individuals of their age and health. Bewildered by this strange outbreak, the Centers for Disease Control and Prevention, CDC, initially labeled the mysterious condition gay-related immune deficiency, or GRID, a name that tragically fueled a wave of prejudice and discrimination. It wasn't until 1982 that a more accurate and inclusive term, AIDS, Acquired Immune Deficiency Syndrome, was adopted, acknowledging the reality that the disease affected individuals from all walks of life, far beyond the confines of the gay community. Years later, painstaking research would reveal the virus responsible HIV originated in chimpanzees in Central Africa, having likely jumped to humans through the practice of hunting and then spreading silently and insidiously for decades. But in those early, terrifying years, the story was shaped more by rampant fear and misinformation than by scientific understanding and compassion. During this time, receiving a diagnosis of HIV felt like receiving a grim decree of imminent death. A wave of terror washed over the general population, stoked by rampant misinformation and a profound lack of understanding. This fear quickly curdled into disgust and prejudice. The stigma surrounding AIDS was a heavy shroud, suffocating those afflicted and pushing them into the dark corners of isolation and denial. In the absence of answers, rumor and prejudice raced ahead. Entire communities, gay men, people who inject drugs, sex workers, and later people in sub-Saharan Africa, found themselves blamed, shunned, or ignored. Governments and health systems scrambled. Families tried to care, researchers raced, activists insisted, clinics opened, beds filled. The human cost mounted. Families gripped by fear turned their backs on their own children. Friends once close disappeared without a trace. This was more than just a medical emergency. It was a deep wound in the fabric of our shared humanity. The government's response was agonizingly slow, appearing indifferent to the suffering, which only deepened the sense of despair and abandonment. It wasn't until 1985 when the beloved actor Rock Hudson bravely revealed his AIDS diagnosis to the world that the disease was thrust into the harsh glare of the public spotlight, finally compelling a global conversation. But even then, the suffering persisted, a constant gnawing pain. Yet from the depths of this profound sorrow, a fierce spirit of resistance ignited. Determined groups like ACT UP, armed with the unforgettable battle cry, "Silence equals death," rose up and waged war against apathy and injustice, relentlessly demanding access to better treatments and an end to the systemic neglect that had allowed the crisis to fester. The scientific race was on. In 1987, the FDA approved the first drug for HIV, AZT. It wasn't a cure, but it offered a glimmer of hope. AZT, or zetavutin, worked by interrupting a crucial step in the virus's replication cycle. It bought time, but the relief was short-lived. AZT had brutal side effects, including severe anemia and fatigue. The drug's high price also made it inaccessible to many, leading to furious protests. In the long run, AZT alone proved ineffective, as the virus quickly mutated and became resistant. But this first step was monumental. It showed that treating HIV was possible and laid the groundwork for the future. The middle years of the 1990s ushered in a real turning point in the fight against HIV. Researchers came to a critical understanding. Attacking the virus with just one medication would never be enough. The virus was far too smart and adaptable for such a simple approach. But what if they used several drugs at the same time? In 1996, a revolutionary treatment called highly active antiretroviral therapy, or HAART, was introduced, and the world of HIV treatment was transformed forever. This cocktail, a powerful mixture of 3 or more medications from different families, was designed to strike the virus at various crucial stages of its life cycle. It was truly a breakthrough moment. For the first time, individuals living with HIV witnessed their viral loads. The amount of virus in their blood dropped dramatically to levels so low they were undetectable by standard tests. As a result, their expected lifespans increased significantly, stretching far beyond what anyone thought possible. What had once been a certain and swift death sentence was now becoming a long-term, manageable health condition. And while these therapies were life-saving, they still came with unpleasant and sometimes debilitating side effects. Before we continue, if you are learning something fascinating from this video, then consider subscribing to the channel for more of such videos, and also don't forget to hit on the like button in order to promote the video and the channel as a whole. Time passed by and prevention took many shapes. Safer sex messaging, condom distribution, and clean needle programs saved lives. But in 2012, the world gained a new biomedical tool: PrEP, pre-exposure prophylaxis, a simple pill taken by HIV-negative people to dramatically reduce the risk of infection. Truvada's approval for PrEP sparked a broad public health rollout and new conversations about who benefits from medical prevention. The World Health Organization later recommended oral PrEP for people at substantial risk. Recent UNAIDS and World Health Organization data show roughly 40 to 41 million people living with HIV worldwide, with over 1 million new infections each year and hundreds of thousands of AIDS-related deaths. Numbers that remind us the fight isn't over because inequalities persist. Outcomes vary by income, gender, race, and geography. Black men and women, marginalized communities, and people with limited access to care continue to bear a disproportionate share of illness and death. Now, individuals living with HIV who consistently take their medicine can look forward to a normal lifespan, enjoying robust health, and crucially, they can't pass the virus on to others. This represents an incredible victory for science and public health. Science never sleeps. The last decade has brought long-acting injectables for prevention and treatment, new drug classes that simplify regimens, and dramatically improved imaging and diagnostics. Clinical trials for vaccines continue, and researchers explore gene editing and immunotherapies. High hopes that once seemed fantastical are now active research programs. But even as technology races forward, so do social and economic challenges such as drug pricing, distribution logistics, and politics will remain gatekeepers to progress. If you learned something from this story, then we invite you to show your appreciation by hitting on the like button below. Help us spread this message of hope and resilience by sharing this video with a friend, a family member, or anyone you believe could benefit from its powerful message. And if you're eager to explore more inspiring and informative stories that dive deep into the fascinating realm of health and well-being, be sure to subscribe to our channel. By subscribing, you'll become part of our growing community and gain access to a treasure trove of content designed to empower you on your own personal journey to a healthier, happier life.